Hello. Rectal cancer is a very specific entity and it needs a very specialized management. So to understand rectal cancer, we have to understand is rectum is the last or the lowermost portion of the large intestine. What would be the symptoms? Common symptoms include bleeding while passing stools, and often patients notice change in the pattern of how you pass stools. That is, there can be alternating constipation or diarrhea, or surprisingly, sometimes people notice change in the caliber or the diameter of the stool. How would you investigate? So the common investigations are firstly a colonoscopy, wherein a camera is passed and the rectum is checked whether there is any mass or not, and a biopsy is taken, and further tests to add upon it are MRIs and CT scans, etc. So now once the diagnosis of rectal cancer is done, how would we go about treating it? So surgery forms the mainstay of treatment. Along with surgery, we have other weapons like chemotherapy and radiotherapy. We can classify rectal cancer as early rectal cancer or advanced rectal cancer. In early rectal cancer, the primary treatment is surgery, following which you can receive chemotherapy and radiotherapy based on the staging of the disease. For advanced rectal cancers, the treatment is slightly different. You might need a preoperative session of radiotherapy followed by little chemotherapy. Then you go on to surgery followed by some strong chemotherapy. Now, the most common question is what surgery will be done and will I be able to pass stool from my normal route even after surgery? So there are two main procedures. One is known as a low anterior resection and the second is known as an abdominoperineal resection. So when we talk about an LAR or a low anterior resection, in this procedure, the part of rectum is removed and the remaining parts are joined. So the stool passing happens through the normal ilia, that is through the normal anal canal. However, sometimes it so happens that the cancer is located at such a situation or at such a position that it is not possible to keep the anal canal or the sphincter muscles. So in that case, the entire anal canal is removed and a new area for passage of stool is done on the abdominal wall. So to make it very clear, in case of an LAR, you will pass stool normally as you did previously. In case of an APR or an abdominoperineal resection, the stool passage will happen through a stoma which is made on the abdominal wall and the anal canal is permanently closed. Now there are two important aspects in terms of rectal cancer surgery. First is saving life, and after that is saving the sphincter muscles. So we cannot and we should not, think of saving the sphincter muscles at the expense of saving the life, because our first target is remove the entire tumors. Then after removing the entire tumor, if we can save the sphincter muscle, then well and good. Then the patient can pass stool normally. However, if just the target is to preserve the sphincter so that the patient passes stool normally, in the process, if we leave tumor mass, then that's not justified. But today, the good part is that we are performing low anterior resection, ultra low anterior resection, wherein we are keeping a small margin of 2 centimeter, as low as 2 centimeter, and saving the patient as well as saving the sphincter. But ultimately, it depends exactly on where the tumor location is. Both these procedures are life-saving and both these procedures can be done absolutely laparoscopically. Thank you.